Sciatica. Well, what is it? It's basically a catch-all term that generally gets used to describe pain or symptoms of some kind into your leg. Well, what is it that's causing the symptoms into the leg? Well, the sciatic nerve is a group of nerves. It's actually the largest nerve in your body. It's a group of nerves that come out of your back. So these nerves exit out from the space in between the vertebrae and your back. They all stay separate until they get to a point just at the back of your hip, right below your waistline, right in the middle of your buttocks. And those muscles all join together into one nerve that becomes what we call your sciatic nerve. And they join together because what they need to do is that nerve needs to travel through a hole in your pelvis. It needs to travel through a hole in a group of muscles to get through your pelvis, out through your buttocks, and then down into your leg. And then it will split again into its separate pieces. And those separate pieces run to your shin or your calf or down into your foot and various areas of your leg. And the nerve works to give you sensation, pain, numbness, tingle, etc. So if there's no pressure on it, you won't have those, but it gives you function, muscle function, temperature, hot and cold, things like that. It delivers the signal of the nerve down into the lower part of your leg. So imagine that the sciatic nerve is like a garden hose, and if I have the garden hose connected to the house about 20 feet away, and I'm standing here watering the flowers, I would have to walk back to the house and turn the nozzle on, and then the water would come out, and the water would come out over here where I'm at. But if somewhere along the line I put a pinch or a crimp in that hose, let's say somebody stands and pinches it, there's going to be less water that comes out. So when we have symptoms related to our sciatic nerve, it's because there's some change in the flow of the signal down that nerve. The nerve is getting less of a signal than it's accustomed to, or in some cases it could be getting more of a signal than it's accustomed to. But if normally the nerve is accustomed to this much signal and there's less, which is typically the case because there's pressure on it from something, that decrease in the signal, the body perceives that as an ache, a numbness, a tingle, a sharp pain, a burning, a stiffness, a weakness, whatever it might be. And so if you get any of those symptoms that run anywhere down the back of your leg, that's a good sign that you're experiencing some level or some degree of sciatica. You may also have back pain. You may also have symptoms into your calf, into your foot, etc. But true, by the definition, true sciatic nerve pain is going to be down the back of your leg. It can get pretty debilitating. You cannot find a comfortable position. Moving and doing anything during the day just becomes impossible. Even laying down sometimes gets to a point where it's comfortable for about 10 minutes, but then after that, that ache and that burning in the leg starts to come back. So there's really two main treatment options. The first is more of a temporary treatment option. That would be medications or injections. So think about it this way. If something's pressing on that nerve and giving you those symptoms, if you took some medication, let's say a muscle relaxant, well, it's going to release some of the tension in that piriformis muscle, but it's not going to change what's actually going to cause it to go back and being tight. So in the 8-hour window that you've got that muscle relaxant in your body, yes, you might have less symptoms, but it's a false fix to the problem. You could do a cortisone injection or a steroid injection directly into that sciatic nerve, get instant relief in most cases, but it's not going to be long-lived because all I did was change what the nerve was feeling. I didn't change what was causing the problem. And so while those are very valuable treatment options in terms of helping to reduce the symptoms, they aren't very good long-term treatment options. Well, that's really where physical therapy comes in. Physical therapists are the only movement specialists that are able to fully evaluate and assess what's going on with your SI, with your sacroiliac, with your sciatic nerve, with your piriformis, and figure out exactly what it is that's causing that pain and those symptoms down the back of your leg. And once we've done a full evaluation and we've determined exactly what's causing the problem in you, then we can put together a treatment plan that's going to address that. Yes, sometimes it does mean taking some medications at the same time to minimize your symptoms so we can do things. But long term, what we're going to do is fix the rotation of that pelvis so that it's back to its neutral position, so that the pressure is off of the sciatic nerve and the symptoms are gone. We're going to get that piriformis muscle to permanently release. Unlike a muscle relaxant that temporarily gets it to release, manual physical therapy is going to get that pressure off of that nerve and keep the pressure off of that nerve. Keep in mind that not all physical therapists are manual specialists. You need, in order to treat sciatica, you need to see a physical therapist that is a manual specialist, somebody that can work on rotating that pelvis, work on getting that hip to move the way that it's supposed to so that your pelvis doesn't have to move, work on getting your spine to do what it's supposed to do, get that piriformis muscle to fully release and stay released and not tighten back down and put that pressure back on. All of the physical therapists here at Loudon Sports Therapy Center are manual therapists. They all are expertly trained in how to do those things. So if you're having any symptoms of sciatica, any symptoms into the back of your leg or any part of your leg for that matter, get it treated. It's not going to go away on its own. It's only going to get worse. Get it treated by treating the symptoms now and fixing the problem in the future, and get it taken care of.